Hi, everyone. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us for part 2 of this very special 4-part series on vaccinations, where we're providing you with the facts to make an informed decision. Well, tomorrow is a big day here in the state of Connecticut. The guidelines for vaccine eligibility opens to those 16 and over. We are happy to have with us one of our experts, one of our many experts, to answer all of your questions today. Dr. Henry Anyimadu. He's an infection prevention specialist at the Hospital of Central Connecticut. Dr. Anyimadu, I am thrilled to have you join us today. It's so nice to see you.
Happy to be here, Tina.
Well, we appreciate your expertise throughout this pandemic. Tomorrow, obviously, we're on the eve of a very big day here in the state of Connecticut. Vaccine eligibility opens up to those 16 and over. What do you want to say to the folks out there today who are prepared to maybe get that vaccine tomorrow, maybe parents of children 16 and over? What's your message today?
I think it's an exciting day tomorrow that we can have everyone who wants to get a vaccine get vaccinated. It's really exciting, and that's what we've all been looking forward to. I'm hoping that there wouldn't be any hesitancy at all, and especially our younger folks, because we know that right now they are the ones who are driving majority of this infection, those within the ages of 20 and 29. The State Department says that those are the ones that are driving the infection. So if everyone can get a vaccine and those that are 60 and older can get a vaccine, that will definitely be phenomenal, and it will be a great experience. So I will encourage everyone to get ready and get ready for the shot.
Well, I know all along you've been a tremendous advocate of getting vaccinations, even to those who are hesitant to get the vaccinations. And you have remarked in several of the press conferences that we've had to say that vaccinations are the only way that we're going to stop the spread of this virus. And you're very adamant when you say that.
That's right. That's right. The more we learn about this virus, it looks like that's the only way we can get out of this pandemic. And we've seen proof everywhere in real-life clinical trials, outside of clinical trials. We've seen that those that are getting vaccinated, even right here in Connecticut, now we don't see patients coming from nursing homes anymore because almost about 75% or more of our elderly population have been vaccinated, so they are not getting infected. And even if they do, it's just a mild illness. And we've seen other studies in other states where they've looked at healthcare workers who got vaccinated, and there's a significant decrease in infections in healthcare workers. So the more we learn about this virus, the more we know that the only way out of the pandemic is vaccination.
Absolutely. Dr. Anyimadu, can you explain the epidemiology in terms of now we're seeing younger people with it? And, we've seen the older population predominantly that has been vaccinated, and now it seems as though the virus is moving down toward the younger population. We've seen some cases where younger folks have been diagnosed with COVID-19. Can you sort of explain the epidemiology behind that and how viruses work to sort of move along into different age groups, if you can?
I think all along, younger folks were getting infected, right? It's just because the older folks had a somewhat reduced immunity. They had multiple comorbidities, so they were getting more hospitalized and they were dying from this infection. Right, but all along we've seen younger folks that are getting infected. The only reason why they've become more apparent or more obvious right now is because of the fact that the older folks, those that are older and those that are in the nursing homes, have been vaccinated. So we are not seeing a lot of infections in those that are older or those who have the comorbid. But younger folks haven't been vaccinated, those between the ages of 16 all the way to 45 have not received a single dose of the vaccine, and thankfully tomorrow they will be able to get the vaccine. And that's the reason why they are the ones that are driving the infection or the case rates right now. And another reason is that we know that our younger folks are not as meticulous as older people in maintaining all those public health measures that are supposed to be in place, like wearing a mask, physically distancing yourself, washing your hands. We know there is a challenge for our younger folks. And we see them partying, we see them in groups not wearing masks, and this virus is real. And they will take advantage if you don't put these public health measures and mitigation strategies in place. So that's the reason why it's become more clear that the infections are being driven by the younger folks.
Yeah, we're certainly not out of the woods yet, and I think as we go along and people get vaccinated, I think you become a little more relaxed and think, well, I'm vaccinated. But the truth and the fact is the reality is that we're not out of the woods yet. We are still in a pandemic.
You're very right. You're very right. And another concern that come up, and as you rightly mentioned, people get one dose of a two-dose vaccine, and they think that, they are immune just by getting one dose, and they're ready to hit out there and go out there and do whatever they want to do. But we are not out of the woods yet, and we are seeing people that are coming in, unfortunately, after a dose of the vaccine, a few days after, with COVID-19. And why is that? Because they haven't had optimal protection, optimal immunity from the virus. They've gotten only one dose, and unfortunately they get themselves exposed and they get infected and come in.
And how long after you have the messenger RNA vaccine versus Johnson & Johnson do you develop that immunity, that 76% for Johnson & Johnson and 94 and 95% for the mRNA vaccines?
So optimal immunity is 2 weeks after your second dose of the mRNA vaccine. And then for Johnson & Johnson is a one and done. So once you get your shot, 2 weeks after that is when you're optimally protected from from the virus.
I want to talk about the variants that we're seeing, the B117, the other variants that we have been seeing. What are your thoughts on that? What do you want to tell the viewers about these new variants? And in terms of those folks that are vaccinated?
So the truth is the variants are real. And I think that's where we need to establish it, that it's real. It's not like it's a hoax out there. It's real. We're seeing these variants that are causing infections. There are several of the variants from B117 to B1351. That's the South African variant. And then we know of the P1 and P2 variants from Brazil. We know the UK variant, that's the B117. We know the California variant, the New York variant. So there are several of these variants. But the one that's become concerning, especially in our state, and all of these that I mentioned are variants of concern, like the CDC called them. They are concerning. But one that's become even more concerning in our state is the B117. That's the UK variant. And we know that about 40% of the circulating virus in our communities right now is the B117. Right. Why is that important? Because the B117 is known to be more transmissible. And that means they can infect people more easily than the wild type or the wild variant or the wild virus that we've been dealing with all throughout this pandemic. And not just the fact that it's more transmissible, but it's known to cause even more severe disease compared to the wild variant. The wild type virus.
Right.
So it is concerning because if people don't follow all these mitigation strategies that we've all been talking about and let their guards down, then we will see more infections, we will see more deaths, we'll see more severe disease, more hospitalization. The good news, though, is that we know that even though the vaccine, the immunity that we get from the vaccine or the antibodies, the neutralizing antibodies that we get from the vaccine is a little reduced when it comes to these variants. At least we know that when it comes to protection, it still protects us from infections with these variants.
Absolutely.
So that's good news, and that's one more reason why everyone needs to get the vaccine, because you're still protected against the variant.
Well said. Great explanation. We are getting a lot of questions on Facebook. We have a question from Rachel. She asks, as an immunocompromised person who is going into Hartford Hospital for surgery in late April, why can't I get priority for a vaccine? Certain conditions are being prioritized tomorrow. Is that correct?
Well, now prioritization is out of, it's not, we're not using prioritization now because everyone who wants to get a vaccine can get a vaccine tomorrow. Right. So it shouldn't be a problem for an immunocompromised person to get a vaccine. I think we've all been talking about it. Transplant patients, immunocompromised patients should have been prioritized, but for some reason, not for some reason, but we were using the age-based prioritization, which was mainly because of the fact that we knew that those that had comorbidities, those that were advanced in age, were the ones that are dying from the virus, from COVID. So if you want to prevent death, then vaccinating those that are at risk of dying was the way to go. But the good news is now everyone who wants to get a vaccine can get a vaccine. So it shouldn't be a problem at all for an immunocompromised person to get a vaccine tomorrow.
Right, 16 and over. Exactly. We have a question from Karen. Can younger people get any vaccine, or is there one that is better than others? Thanks, Karen, for the question.
So thank you for that question. That's a very good question and a very important one, because we know that it's only the Pfizer vaccine that's approved for those that are older than 16 years. So between 16 and 18, the only vaccine that is approved is the Pfizer vaccine. So if you're going to get a vaccine, if you're registering to get a vaccine, and you're within that age range, 16 to 18 years, you want to make sure that you're getting the Pfizer vaccine. Otherwise, all the vaccines, the messenger RNA vaccines, and the Johnson & Johnson vaccine, all of them will prevent severe disease, it will prevent hospitalization. So all of them are really good, and you can get anyone that you want outside of that age range, the 16 to 18 age range. You must get the Pfizer vaccine.
Karen has a follow-up question to her first question. Are there reactions to the vaccine the same for younger people as for older people? You know, you hear a lot of folks who have already had the vaccine that at least with mRNA, the first shot was okay, second shot not so much. What is that like for younger folks? What could we potentially see here?
So in general, in the clinical trials, we know that those that are younger did have a more robust reactogenicity. And what that means is that they reacted more robustly than the older folks, right? So what that translates into is that they tend to have more of the reactions, including the fever, the headache, the injection site reactions, the fatigue, and the body aches, right? So, and all that, why does that happen? It's just because the younger folks have a more robust immune system, right? And the reason why we get all these reactions from the vaccine is because your immune system is ramping up. You get an initial dose, that's the that's the primer dose that wakes up your immune system. And then the second dose is more of a booster dose that kicks up your immune system to produce even more antibodies. Right? And when that's happening, whether you are reacting to the infection itself or whether you're reacting to the vaccine, you will see these signs and symptoms. That's the headaches, the fevers, the myalgia, the headache, the body aches. You will see that. The good news is for the vaccine, it goes away very quickly. We're talking about 24 to 48 hours. Right? And what folks need to know is that these can happen from 1 to 7 days, from day 1 to day 7 after you get the vaccine. And when I talk about this, I usually like to give myself as an example. I got the vaccine on a Tuesday, and I was completely fine. I didn't feel a thing. By Saturday, I started having chills, low-grade fever, headaches, body aches, and I was very concerned because I had read everything there is to read about the vaccine, right? But it was so distant or far away from the dose of the vaccine that I got that I didn't think that those reactions were from the vaccine.
Connected, right?
And I got really worried. So I had to get tested for COVID, and thankfully I was negative. So what we need to keep in mind is that these reactions can happen even days after you get the vaccine, right? But the good news is it goes away very quickly. As quickly as it comes on, it goes away very quickly. And they're usually mild, and you can take Tylenol or any NSAIDs or ibuprofen to take care of it.
And Dr. Anyimadu, was that after your second shot?
No, interestingly, that was after my first shot.
Interesting.
Yeah, but in general, I just want to make it clear that in general, most people will have these reactions after their second shot. I had it with my first shot, and with my second shot, it was a breeze.
We have a great question from John on Facebook. He asks, how long would the effect of the vaccines be once administered? Thanks, John, for the question.
So just to clarify, how long are we going to have the antibodies for?
Yeah, as I understand the question, how long would the efficacy of this vaccine, once you get that shot, how long are you protected for?
That's a good question. So that's something that scientists are still working very hard to find out. And there's a lot of studies. All those people who got the initial vaccine dose in the clinical trials are still being followed, and they will be followed for 2 years or more, right? So we don't know the full answer to that. So far, we know that in humans, up to 6 months, and most of the people who got the vaccine still have antibodies, protective antibodies after 6 months. And in primates, in non-human primates, up to 8 months, we are still seeing reasonable levels of antibodies. So we know that somewhere along the line, these antibodies may wane, but as to how long the protection will be for, we don't know that for sure.
Right. So just as a follow-up to that, we don't know whether this could be a yearly vaccine like the influenza shot, or whether this is a booster that could protect us for many years.
That's right. We don't know that for sure. We don't know if we're going to be getting the vaccine every year or every 8 months, or even whether we'll get a booster vaccine because of the variants that are circulating. Those are very areas of very active research that is going on, and I know that Moderna and Pfizer are both looking into booster doses because of the variants, and they are also looking at tweaking the vaccine such that it will take care of the variants that are circulating right now. So we don't know that for sure.
Lindsay has a question. I have seen mixed articles. How long after you have had a positive COVID test can you then be vaccinated? Lindsay, thanks for the question.
So the CDC says that if you're positive for COVID, you should not get vaccinated. But after 10 days of whether you are symptomatic or not symptomatic, after 10 days, you can get a vaccine.
Edna has a question. She asks, is there any news to share regarding Pfizer and the 12 to 15 age group? Thanks for the question.
The 12 to 16 age group is actively being studied. At this point, there is no clinical trials or there's no data to suggest that those within that age range can get a vaccine. And remember, what they are looking at is safety and efficacy. They want to be absolutely sure that it's safe for that age range. Most experts believe that they don't see any reason why it shouldn't be safe, but we need to prove it so that we can safely give it to our younger folks within the ages of 12 to 16. To be honest with you, they are actually studying 6 months to 11 years as well. So as young as 6 months. So there's a lot of research that's going into how safe these vaccines can be for our younger folks.
Certainly, we've come so far, but certainly so much more to learn. Dr. Anyimadu, thank you so much for joining us today and providing your expertise. You have been a sense of calm throughout this entire pandemic, and with your knowledge and expertise that you've shared with the public, we can't thank you enough. And obviously, of course, for all the wonderful work that you've done on the front lines in dealing with this pandemic. We appreciate you.
It's always a pleasure.
Thank you.
Thank you.
If you'd like more information, just simply log on to hartfordhealthcare.org/vaccine. Thank you once again for joining us. We'll see you next week for another special edition of this Facebook Live segment with one of our experts. Thanks always for the wonderful questions, and we'll see you real soon. But for now, be well.